Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for joining me today. Thank you so much for spending your time with me. If you got a few more extra seconds, I would really appreciate if you gave it that thumbs up and also subscribe to this channel because it helps this channel to grow. And I am giving useful and helpful information. That is always my goal. I don't want to be like the other channels out there who give really generic information or really no information at all. This is really to give you the help to deal with your issues. Not everyone can come out to see me, and so this channel is for you. The question I want to ask or answer today is, what is the recurrence rate for anal fistulas? And let's break down that question because it is a kind of a big topic. Let's do some background. So what is an anal fistula? Well, an anal fistula is a tunnel that connects the inside, the gland inside the anus, all the way to the outside, which usually is a hole on the skin right around your anus. The tunnel is made up of inflammatory tissue and scar tissue, because it's fighting off a chronic infection or chronic living. It's fighting off the bacteria which has been living in that tunnel for some time, right? It's always living in there and making the pus. So the bacteria are from the stool and our poop, and this anal fistula got started from an anal infection. And that anal infection started from the gland inside the anus. The gland secretes mucus, but one day it got clogged up and then started to get backed up, and then it got infected with bacteria. And so 50% of people heal everything, the infection, and don't get a fistula and look as if that nothing ever happened to them. The other 50% develop a fistula, and really it's a coin toss. And we don't understand what the factors are that put someone in the completely healed and okay group all the way down to the fistula group. Alright, so what does recurrence mean? Well, recurrence means the chance of it coming back. So the treatment for a fistula is surgery. There are no medications, there are no creams, or antibiotics don't help to make these go away. And so after you have a surgery to try and treat and get rid of the fistula, heal it in other words, what is the chance that it's going to come back, doc? You know, if I'm going to do this surgery with you because I don't want this fistula anymore, what are the odds that this may be back and, you know, I'm going to be suffering through what I'm already going through? And the question is quite big, like I said. So when you look at the research on anal fistulas and recurrence, we've tried to drill it down to as many different factors as possible. There are really three major groups in my opinion. You know, there are patient factors, so the person with the fistula, and their medical conditions like diabetes. Is there anything like peripheral vascular disease? You know, in terms of the fistula itself, so the characteristics of it, the anatomy of the fistula, are there multiple branches? Is it high towards the rectum or is it low towards the outside skin? And then there's other things such as surgeon factors. You know, there's a technique that needs to be that's required for these surgeries. They're not straightforward surgeries at all. And definitely experience comes into play, and what to do, you know, troubleshooting these fistulas, understanding what might be wrong, that all plays a part in this entire question, right? And so it's not as simple as, you know, they just didn't do one step right. And the other thing too is it's so difficult to control the fistula healing. Why? Because there is poop 100% of the time. The poop creates it contains a lot of bacteria, right? And if it was as simple as a boil on your hand, you get it lanced open, then the pus drains out, you put a bandage on it, you keep it clean, and 100% of the time, you're going to be all right. You're not going to get something like a fistula. But in the anus, it's different. The poop, you have to keep using your anus. And the bacteria, no matter what, even if you're not pooping, the bacteria is always going to be there. And so when you're trying to deal with these wounds, it's not as simple as just putting a band-aid over your bottom end, over your anus, and just keeping it clean with the bar soap. It just doesn't work that way. And so in terms of answering the question, what is the recurrence rate, doctor? The answer is, we don't know. To break it down and make it a little bit more clearer though, okay, depending on how simple your fistula is, the anatomy, definitely that's more successful, more likely not to recur. So in other words, a low recurrence rate. But if your fistula is deemed to be complicated, then that's more likely to have a higher recurrence rate, because these are more difficult to have your body heal correctly. And the other thing that can that can make this whole question make a little bit more sense is, if I've had 2 surgeries already for an anal fistula, are my recurrence chances the same, or is it better with a third? The answer to that question is, if you had several or one surgery and it recurred, your next surgery will probably have a higher recurrence rate, because there is something very complicated about these fistulas that keep coming back. And you can tell from my answer that it is extremely dependent on so many different factors. It's not just as simple as saying, oh yeah, you're reading on a piece of paper, you see the patient has anal fistulas before, it's complicated, you're going to have a higher recurrence rate. And I don't think it's the case. I think it's totally, many things can compensate. Like for example, a really experienced surgeon can probably make up for another surgeon that didn't consider one thing, right? That's what experienced surgeons really know, is they know the ins and outs, they know the pitfalls, etc. And that's just one example where it's not very clear, and it's so hard to pinpoint a number. Okay, and I'll tell you that fistulas, because they require surgery to be healed, this is a discussion that really needs to be had between you and the surgeon, okay? To speak frankly about whether this surgery is something you should do, and what are the possible complications, and talking about recurrence rate. Because you definitely need to know that this surgery is not 100% guaranteed simple, and while most of these anal fistula surgeries are successful, I give you, that's definitely true. Vast majority are. However, some patients fall into a different group where it is much more difficult. It takes 1 or 2 surgeries to complete the entire healing process, and so it can be a long road, right? So I'm sorry that the answer was not what you hoped, but it's what I was trained in, and why my training takes so long, because it does take a lot of experience and seeing these things to understand what needs to be done and how much these fistulas deserve a lot of respect when you're treating them, because they can definitely fool you. Again, I urge you to develop a good relationship with your surgeon and ask those questions. Have that discussion so that you feel prepared as to what you're going to step into. So I thank you so much for joining me today. Please like and subscribe, and I'll see you in the next one. Bye-bye.